So we know that the government has got to save money. We know that there was the recession in 2008, 2009, which led to austerity measures for 10 years. That's the bit where the government has to spend less money. They have to make massive savings, and we'll go more into that in a minute. But now with coronavirus as well, even though austerity measures had been coming to an end, there's going to be some tough times ahead. So we need to look at different ways the government can save money, and that's what we're going to be doing in this lesson. So if we remember the three big expenses to the government, benefits and pensions, the NHS and education, how on earth can we reduce costing on those kind of things? These are for the most vulnerable people. So how on earth can we try and save some money? The video that is linked here, I will put in the comments. Basically, it talks about the effect that austerity measures have had. So the government had to save money and cut back on huge services. For example, there's 20,000 less police officers on the streets than there was 10 years ago. Homelessness has more than doubled. About 40% of children will be in poverty. Absolutely, the most vulnerable people in society are the ones that austerity has hit hardest. That's a massive issue. But how can the government save money? So there are lots of different ideas that we can look at. What you guys have got to do is you've got to work out from these ideas what the benefits are to society, but what the problems are as well. If you think with pensions and things like that, you have got people now having workplace pensions, because obviously people are living a lot longer. The average life expectancy has increased massively since the pensions were last reviewed. The retirement age has gone up, if you remember. So now it's 68 before you're allowed to retire. It used to be 60 for women and 65 for men, which is odd because a woman's life expectancy is actually longer than a man's, but it's now 68 for everybody. The issue you've got with that, would you like a 68-year-old teacher standing in front of you? Are you really going to listen to them? Are you going to listen to a 68-year-old copper telling you to get back home? I don't know. I don't know what the answer is. So one of the main things they've had to do is to try and get rid of the state pension, unless you haven't paid contributions, and that's the only way you can earn it. So basically, everybody now is asked to have a workplace pension where every month or every week, depending on how you get paid, you pay into your own pension fund. It will be topped up so that when you retire, you're actually paying for your own pension. That's a massive way that they've tried to cut down on those expenses. The only problem is, though, this is going to take decades for that to roll out properly, because obviously if you're in your 50s and you've only just set one up, you're still going to have to rely on a state pension to some extent. So that will work, but it's a big chunk of your wages that has to go out. So that's going to, increase the sort of hardship that you go through every day. And also, it's going to take ages to take full effect, but it is a better way and will save the government money. So let's have a look at a few more. So the first one's private healthcare. In the UK, we've got the NHS, which we can all agree is an amazing thing. We did see, though, over coronavirus that the NHS has been vastly underfunded for years. There was actually a pandemic fund, and the government decided to get rid of it a few years ago. So we had the horrible thing where our frontline workers, the NHS, didn't even have enough PPE, protective clothing, to equip them to be able to fight the coronavirus. So private healthcare, even though the NHS is getting such a big amount of the budget every single year, private healthcare is a way of eliminating that expense from the government. It would mean we'd be like America, where you have to pay health insurance, get your own healthcare plan set up, or every time you go and need to see a doctor, you have to pay for it. Brilliant in a way. Benefits are it's going to save the government absolutely loads of money. Waiting lists might be shorter, and there are some people in this country who already have private healthcare and they have much shorter waiting lists and get to see specialist doctors. So it is good because it would save the government a lot of money. The problems with it, though, are quite self-explanatory and quite obvious. What if you can't afford it? What if you're on benefits, or if you're on a low income, or you just basically can't balance the books to be able to afford private healthcare? Do those people just get ill? Do those people just die? Do those people just suffer? I always give the example of Dr. Pimple Popper. If you've ever watched that, and please Google it if you do, but don't be sick and don't blame me. This is an American TV show where Americans who haven't been to the doctors or have been and couldn't afford the treatment have skin complaints like massive cysts and stuff that grow kind of the size of footballs. Dr. Pimple Popper is kind of this really weird TV show that gets rid of, kind of squeezes these cysts. She'll do it for free because it's for a TV show. But in this country, you don't see many people walking around with growths like that. And the reason is our healthcare is free, so we go and get it sorted before it gets to that problem. Do we want to end up like America? What about people who can't afford health insurance and they need life-saving treatment? Maybe they're asthmatic or diabetic or epileptic and they need that treatment, or cancer treatment maybe. They need to be able to access healthcare. It's a really weird thing. The NHS is kind of the flagship of the UK. It's what makes us who we are. Should we be getting rid of it? Okay, another one that was on there then, we had got prescription charges. So prescription charges are when you go to the doctors, not you guys because you're too young, but as an adult, when you go to the doctors, you will pay a fee, a small fee for any medication the doctor prescribes. I think the prescription charge is about £9.60. So if they prescribe you with 28 antibiotics, you pay £9.60 for them at the chemist when you collect them, unless you are on certain benefits or unless you've got certain pre-existing conditions. Like me, I'm diabetic, so I don't pay for my prescriptions because it would probably cost me £100 every month, and it is life-saving treatment. I would die if I didn't take it for a day. So they are, you know, nice in that way. I don't have to pay for it. Okay, the £9.60 is not the full cost of the drugs. Those drugs are probably far, far more expensive. It's just a small token to pay the NHS. So, brilliant points. Yeah, it gives some money to the NHS. They get something back for all that they do. It does help with the running of the country, and it does help with balancing the books. The bad point is, though, it doesn't cover the full cost. So basically, there's a hell of a lot of people who are getting prescriptions, and yes, it's helping out, but it's not the full cost. Another point that was on there was academisation. So this is schools. So we know that education is a massive part of the bill as well for the government. With academies, they are no longer run by the local council. They're no longer under local council control. So they are not paid for by the government. That's brilliant because it saves an awful lot of money. They don't have to pay for the buildings, for anything like that. They don't have to pay for that. The problem is with it, though, is that academies are no longer under council control. They no longer have to conform to the regulations as such. There's certain freedoms that they can have that make it so they are kind of self-governing. They still get Ofsted. They still get, you know, they still have to do GCSEs, but there are freedoms within them. The problem is with that, are these kids in academies actually getting an equal education to kids who are in mainstream schools, to kids who are in state-funded schools? Are they getting the same quality of teaching? Are they getting the same regulations? There's big questions over it. The other thing that they can do in academies, they tend to use a lot of unqualified teachers. So they're a lot cheaper, which again saves them money. And academy is kind of like a business rather than a service provided by the government. And then there's a lot of questions being thrown up with that. If we have unqualified teachers delivering lessons or cover supervisors in charge of curriculum and lessons, is that doing our children a disservice? You won't go to a doctor's and go and see an unqualified doctor, but we send our kids to school with unqualified teachers. It's a profession. It's something you have to train to do. So there are massive questions about that. And there are amazing unqualified teachers. There are some who are absolutely brilliant. And just because they haven't got the degree to prove it doesn't mean they're any less good. However, there is a question over the quality of education that's being delivered. Okay, another one is something called bedroom tax. This is a tax that was put on for everybody who rented a house and were on benefits and they got a spare bedroom. And if they got a spare bedroom and they were receiving housing benefit, they had to pay 25% of the rent to accommodate for them having that extra room. And the reason is that there are so many people who are overcrowded in their houses, and that they need to free up those bigger houses for families. So it was to try and encourage people who got a spare room to give up that property, move to a smaller property, and allow other people to use those houses, which in principle is brilliant. And as somebody who was in a council house with 2 kids in a 2-bedroom flat, we desperately needed a 3-bedroomed house, myself and my partner. And it used to drive me mad when I walked down the street and there'd be this lovely little old couple coming out of a 3-bed house. And I'd be like, I want that, it's not fair. So I do get the point. However, those couples or single people in those 3-bedroomed houses could have lived there, pretty much their entire adult life. They could have brought their families up there. There's the sentimental value to it. You've also got the issue that actually the bedroom tax has been blamed for several suicides. So people who have got these spare rooms who had to either pay 25% extra rent or had to pay 25% rent if they were on benefits, couldn't afford it and ended up killing themselves as a result. So it's really upsetting. For example, when you've got a split family, so perhaps the dad has the kids at the weekend, but because they're not there all the time, he then has to pay the extra rent for those bedrooms. There was also a story of a child who was critically ill and then needed the spare bedroom for all of his medical equipment and for when the nurse had to stay over, and again they made them pay the bedroom tax. So it is actually it's a hard one, as all these things are. If it was easy, we wouldn't be debating it. Another thing that was on there, let me think, what else did we have? Private healthcare, education, pensions. Okay, so what you can do, you can pretty much go through all of those and have a look, think, yeah, that's a brilliant way of saving money, but then also, what about if it's not, or what about the people it actually affects? And we know that austerity has affected an awful lot of people. So just have a think about some of those. Remember, these are the most vulnerable people in society. What would you save? How would you know which would be okay to save money from, which would be okay to perhaps, you can afford to get rid of some of the money? And again, it is really, really, really difficult to know what's right. So some more, for example, how about school policies like healthy eating, the food dude systems? So I don't know if you guys did it in primary school. I know my kids did. They got sort of nurses coming, weighing them, giving them out fruit, little plastic boxes to keep their fruit in and stuff, trying to encourage healthy eating. Obviously that's good because there's a huge problem with child obesity in this country, which leads to health problems, which leads to a strain on the NHS, so it'll cut back on that. But then there's the argument, when does a school start leading your life? When can the government step back and let you be individual and have freedoms? It's something called a nanny state that a lot of people argue about. Then we've got other ways of increasing your health. So banning happy hour in pubs. Happy hour is usually like 6 till 7 or something like that, and it's where drinks are really free, really cheap. And raising the smoking age, so you can't start smoking legally till you're older. These are all ways of trying to improve health, which cuts down on the strain on the NHS, which again is brilliant because it saves money, but you've then got the whole nanny state, and are people just going to do it anyway? Okay, so have a think about what you would do. Who should we protect? You've got this in your booklet, you can have a go at answering it, and then see if other people agree with you.